welcome everybody. This is the episode 4 of Iguchi Natural Health webinar series. I'm here today with Joel, who's one of my close colleagues that I work with, not in the same clinic, but I tend to refer a lot of my patients onto Joel because obviously I don't deal with musculoskeletal issues. So yeah, I sent a few of my patients over to Joel and they're very happy. So we've worked alongside each other for a long time. Now, just a little bit about myself before we get started. You might already know me. My name is Kohei Iguchi, and I've been a qualified naturopath and medical herbalist for about 7 years now. And this whole webinar series is all about getting the right information out there, free information out there, so that you guys can look after yourselves and promote that preventative medicine. Because what me and Joel and other natural and complementary and alternative medicine practitioners like to do is not always see patients when they're sick, but actually just to maintain their good health. So we'll talk a little bit about that today, and we'll actually focus our topic around stress and posture. So stick around, it's going to be a good episode, and yeah, we might as well get cracking. So I did a little bit of an intro for you, but would you just sort of like to briefly introduce yourself to everybody?
Yes, sure. No, first of all, thank you for having me along, and always appreciate the opportunity to share information with people so people can be better informed, educated, and when they're out in their daily life, make more critical decisions about how they use their body and their mind in their environment.
Yeah.
Because of course, cause of all stress is how we perceive it, but how we also perform in our environment.
Very true, very true.
Yeah, and as mentioned, my name's Joel Taylor. I'm a chiropractor for 11 years, based here in Bays Chiropractic in Mairangi Bay, Auckland, New Zealand. Previous to that, worked in Takapuna and over in Mount Eden. It's been a quick few years, I can say that much. But yeah, the amount of different cases we see, the amount of different people we help, it's a job that I feel gives back and allows people to live more comfortable lives where they are more likely to be themselves in. As somebody that is in pain or living with areas of distraction along their spine are not going to be their most best selves.
Yes.
We can help people achieve a level where they are succeeding, then I've done my job.
Cool. Yeah, I mean, we'll definitely get into a bit of that today and see what you can sort of teach us in terms of what we can do at home. But before we delve into everything, and this is one of the questions I always like to ask practitioners, is how did you get into what you do now? Yeah. So chiropractic was something that was presented to me when I was about 19 years old. I was a pastry chef at the time, doing long hours very early in the morning. Right.
Bent over a bench, lifting very heavy bags of flour, and yeah, I still love baking, still love cooking, but I could slowly see that it was something that maybe my body and my effort wasn't going to last as a lifetime career. And those sort of decisions, when you think you found what you want to do, was stressing me out. So my mother, in her wisdom, said, you should see my chiropractor.
Yeah, right, okay.
Not knowing any idea of what a chiropractor was or what they did, and just going off my mother's intuition, I went along and visited a chiropractor out in Meadowbank. And within 3 months, I just felt a level of clarity, both in the way I was articulating things and talking to people, that enhanced my quality of life. And I was like, wow, this is what I want to do for people. Yeah. Especially when I heard the 33 principles of chiropractic, which essentially connect all these ideas we have about holistic health and wellness into an understanding that makes the world seem like an organised place, and it is.
Yeah.
It is.
Yeah, it's very interesting that most of the practitioners that I've asked the same question to say that they have some experience first with receiving treatment, and they felt that benefit coming through in their quality of life and just overall well-being, I suppose. And from there, it just ignites this passion to, I suppose, spread that across our community and make sure that everybody else feels the same sort of benefits as well. So now that we've got a bit of a history around how you started, can you give me a bit of a history about chiropractics? Because I think there's still people out there who's not familiar with chiropractic work, and there's a lot of confusion around, okay, well, what do physios do, what do chiropractors do, what do osteopaths do? So can you give us an idea of the history of chiropractic and what it's all about?
Yeah, I'll try and do my best not to step on any of the true chiropractic historians' toes and get some of that right, and help to explain what I understand of the other complementary alternative professions as well. Chiropractic began 1895 officially. D.D. Palmer, he was originally Canadian, came down to Davenport, Iowa in the United States, and he was working at a university at the time doing several different fields.
Yes.
But he came across a janitor who years earlier had lifted a heavy barrel of molasses, heard a pop in his neck, and went mostly or partially deaf.
I have not heard this story.
Yes, it is the foundation of the first chiropractic adjustment.
Right.
D.D. Palmer postulated that the sound heard by the janitor was a vertebra going out of place. So he had a look. It's debatable whether it was C1 or 2, and decided that through motion palpation and muscle findings that the area was slightly misaligned, what we call a vertebral subluxation complex. He then postulated if he put a thrust into that joint, that it would reassume its position, and that something good could happen, and it did. Within a day or two, most of the hearing came back.
Right.
I can't say it's been replicated ever before. We can't say C1 and 2 will bring back anybody's hearing.
Right.
But it was through that observation he then deducted, well, if this can make a change to one area of the body, I'm sure it can make a change to another.
Right. Okay. Well, yeah, just remember this is for educational purposes only. We're not trying to diagnose or treat or cure any medical conditions, diseases or illnesses. So just remember that. Okay, so that's so interesting. Like I've actually, the years I've worked alongside different chiropractors, and our naturopathic college, we're right next to the chiropractic college in New Zealand, and so I feel like I've known quite a bit about chiropractics, but I actually never heard that story before, so that's quite interesting.
No, people hear that story, and it can it does interest them. After D.D. Palmer did that, the practice got more and more popular, and as it got developed, his son got involved and is well known in the industry for really taking chiropractic at the start and really bringing it to where it is today in its philosophical understanding, as well as its technique and other developments.
Interesting. Okay. Well, and how does it all work? Like, and this is also something that I'm sure everybody's interested in hearing. Is how does chiropractics work?
We can confidently say the science has caught up to chiropractic now. 1895, they didn't have the ability to measure muscle activity, joint reception, brain activity as a result of the adjustment. It was assumed that a vertebra out of place, was putting pressure on a nerve, creating interference. We now know it is like the body is, much more dynamic and intricate in how it works. So the most easiest way to convey that without confusing people is a connection between a joint, how that joint is moving, how the brain is interpreting that movement, and therefore controlling the muscle attached to that joint. When a joint is not moving, it can't send that movement information to the brain, and the brain has no idea how to operate the muscle, so often it will compensate around that area. And just like if we put a cast on my arm, when something's not moving doesn't mean it's not sore. But if we accumulate enough of these areas, it becomes a system which is overwhelmed by compensation, that eventually somebody does something simple like pick up their socks or shoes in the morning and boom, the system can't compromise anymore.
I did that the other day actually. Yeah, it was during lockdown actually. I don't know what I did. I was just setting up my new Wi-Fi router. It's not like I picked up anything heavy. I didn't do any sort of odd movements. I just kind of picked something up and got up, started walking, and then just started having this shooting pain in my back. And I actually had to go and see a chiropractor quite urgently. And it was a Saturday, so it was a bit hard to find anybody that was open. Luckily, my clinic owner's son is also a chiropractor, and so I just went over to their place, gave me an adjustment, and by the next day I was feeling much better. So yeah, it's very interesting how it works. It's very much that holistic approach of here's the symptoms that this person's presenting, but then it's backtracking exactly where that issue comes from, and then treating from there rather than just treating the symptom itself. So, and this is one of the reasons why I love interviewing other practitioners who differs from my field, because it's a field that I can't, I'm not an expert in, and that's when I refer patients on, because that is not my expertise, and I would rather have somebody who has that expertise to treat my patients. So having said that, so going into this sort of the talk around stress. So this whole world right now, in a bit of a chaos with the whole COVID situation. There's a lot of stresses at the moment, financial stress, as well as just not knowing what's going to happen, fear of getting COVID. There's a lot of stress going around. Can you tell us a little bit more about the stress response and what we call a fight or flight response? Can you tell us from your chiropractic point of view what that's all about?
Yes, stress, when applied to how chiropractors understand the body and the world, stress is either constructive or destructive. Is our mind and our body resilient enough to be able to take said stress and grow from it? Or is it just going to slowly whittle down our nutrition?
Yes.
Is it going to whittle down our physical available energy? And when it comes to the nervous system, it senses that stress. It takes everything you've ever seen, touched, tasted, heard, and interpreted, and made a decision whether that is a danger or not. The fight or flight response is a perfect response to an abnormal situation, designed to be there for a short period of time.
Yes.
So that person can run or fight. But when you put somebody in a situation of a lockdown, not knowing whether they're going to have work in 6 weeks' time, trying to take on and deal with the emotional stress of other people in their family and their community, it can be overwhelming. The autonomic nervous system, or another way of saying it is the automatic nervous system, the part that runs the show while we're sleeping, knows what's going on, is sending those 7 billion messages a second up and down our spinal cord to organize the system in a homeostasis,
Right.
is split into two parts, as you would know. It's got a sympathetic side, a fight or flight side, that exists in between and inside our thoracic spine and the mid-back. And then we've got the parasympathetic nervous system, which is like the brakes. And that's at the top and bottom of the spine.
Right, so that's the rest and digest mode, isn't it? Rather
Rest
than
and
the fight or
digest,
flight. Yeah.
yes. Or as mentioned in the latest COVID documentary on Netflix, episode 2, they do a beautiful description describing how sometimes we need to have the accelerator on.
Yes.
Sometimes we need to run, we need to fight.
Yeah.
When that stress is gone though, we need to come back into balance and have both sympathetic and parasympathetic work in harmony.
Yes.
You don't want one, you don't want the other. You want a balance of both.
Yeah.
And there's many ways to help a person get that balance in life, and that's where myself will refer out so that people can get chemical balance in their life. Chemical stress interrupts the autonomic nervous system's response.
Yes, very much so.
Mental stress affects that autonomic response. And physical stress also affects that autonomic response. In particular, outside of COVID, but in most people's day-to-day living, is posture.
Yep.
Yeah,
just myself.
Yes.
Yeah.
The human being wasn't designed to sit as we are. It was designed to sit for several minutes or hours of the day in a squat position, heels touching the ground. Right. The moment we put a child into a chair, the hamstrings, the ankles start to tighten up, which end up spreading to the back in adult years. So when we look at what posture is, how it works, I'll share some tricks and advice and tools to help. But it's important we get an understanding of how posture and stress are related.
Well, have you got some example cases of that? Like, have you had somebody lately or recently?
Not so much cases, but just general facts which are out there within the anatomy and physiology. And when we look at case examples, generic ones, not specific ones, we can say flexion is a stress-inducing force. Flexion is a forwards motion,
right,
as opposed to extension.
Right.
And one thing we can apply to this, and people can practice this at home, is the old fake it till you make it process.
Okay.
If you sit up straight, extending arms out, there's not long before you start feeling different from the position, which is rotated in, sitting down, head forward.
Oh, the classic Mr. Burns.
Yeah, the classic Mr. Burns, or if you put a keyboard in front of you, basically you're typing. And we can't get any further into flexion from this position.
Right.
When we are in a flexion dominant position, we are also assuming that ancient primordial stance of fight or flight. My knuckles are out, ready to run and fight. My head is forward, my head is down, my eyes are up, looking for trouble in the horizon. If we are faking it or assuming a flexion dominant position, we are ensuing stress. We are telling our nervous system and brain, you are under stress.
Wow. This is somewhat new to me as well, just the way Joel's is explaining these things. It's very interesting. So what are some of the things that like people can do at home that could help with that? Obviously, like everybody is sitting on a chair, everybody is typing away on a keyboard or on their phones or whatever it might be to cause that flexion what can you do at home to help relieve that?
Yeah, and there's several things. One thing we mentioned is extension breaks.
Mm-hmm.
If we think of our bodies as giant sensory information gatherers, it needs information in order to know how to correctly control our entire being.
Yeah.
Wherever there is more joint surfaces, there is a higher ability for our brain to process greater amounts of information. So if you've been like this, tapping away all day, what we ask people to do is have a micro break. It takes 30 seconds. You push up off your feet as if you're about to stand up, but you don't. Sort of lift your chest into a higher position. And we don't want military style posture, but just tilting the head back a bit. And most importantly, the shoulders rotating out, elbows straight, and then get the fingers and wrists extending backwards. I know you're a bit cramped up there.
Yeah, no, but this feels good.
Now, while we're doing this, the first thing people let go of is their wrists and fingers. But if you continue reminding yourself, remembering that there's hundreds of joint surfaces inside your hand, you are literally programming your brain that extension is good. It inhibits that flexion dominance and excites the postural muscles of the spine. Even though I'm concentrating on extending this, that extension information ends up controlling this.
So how often, and you said about 30 seconds? Was
30 seconds is best, up to 5 times a day.
5 times a day, that's all it takes?
That's one.
Yeah.
That's one piece of advice. The other thing that makes us more flexion dominant is being over visually dominant.
Okay.
When we are staring at a flat screen, which gives us no depth of field, no tracking, our brain will tend to head towards that fight or flight stress mode.
Yes.
Especially when we're not giving any input into our bodies. So that's where going out at lunchtime, if you have the ability to leave the office, and seeing vast instances, coming in close, watching birds, it seems like normal stuff. Our world has changed the way we use our body, but our bodies have not changed. It still wants and craves the same things that it used to 100, 1,000 years ago. Where I'm also going with that is when we're sitting in that flexion dominant position, we are not giving information to the body. If we slap ourselves in a nice hard rigid chair and call that good posture, that's no good for your posture as much as slouching is, in a way.
Interesting. Okay.
This is where we say the brain loves complexity.
Okay.
And making sitting complicated encourages the body to be more active. Some call it active sitting.
Right.
It can be done on a Swiss ball.
Right. Yeah.
It can be done on a little dome circle.
Oh yes.
Got one over there.
Yeah.
When we make sitting difficult, the body has to use itself to stabilize and guide itself into a better position. It's like Elon Musk trying to land a rocket from space back onto a platform in the middle of the ocean. It's complex.
Yeah.
So, I guess it's more so in recent times that we now understand the complexity of posture. That 90% of our brain's cortical activity is actually dedicated to just doing this, providing that stability and coordination. We take advantage of the fact that if I stick my arm out like this, I don't fall over.
Yeah.
We don't think about it, it's very automatic. But the body needs input, it needs information in order to guide that stability. So by making surfaces uneven, we provide the body better information to therefore control the body with.
Right. So you could use things like wobble boards if you wanted to?
Yeah, wobble boards are a much more complex way to introduce instability to the body.
Yeah.
I do recommend people start with first doing a one leg, balancing on one leg with their knee bent.
Okay.
For up to 30 seconds. If they find that too easy, just fold up a towel, make it a bit more complicated. If that becomes easy, use a wobble board or something else unstable. And even reciting the alphabet backwards, making it cortically difficult, mentally difficult, as well as physically, will encourage the brain to find greater stability, just like landing that rocket.
Yeah, it's almost like
a lot of programming.
Pulled over when you're being accused of drink driving, right? You gotta do that. Recite the alphabet backwards. The compliance might be a little bit low with that, possibly.
Yeah.
Yes. Yeah. Okay. I did have another question though. What are your thoughts around standing desks?
Yes, standing desks. Of course, they came into fashion. Everybody had to have one. They cost thousands of dollars. They've come down in price. Thank goodness. Sitting, standing. The jury is basically out, and it said that both are best. Again, introducing that complexity to the body, variability. We've got to be variability. The body, after 20 minutes of doing the same activity, will go into standby mode.
Right.
And use half of the energy to stabilize the system. This is where, doing those extension breaks throughout the day wakes the body up again, but creating an unstable surface to sit on, like the Swiss ball or the posture dome.
Yeah.
Or not where we're going.
Yeah, I think
sitting, standing desks.
Yeah.
Or being variable between sitting and standing.
Yeah.
So both are good and important.
Yeah.
I had one patient try and take it to an extreme, and they had a standing desk with the treadmill underneath. I think that's going a bit far.
That's a little bit far. Yeah.
That's going a bit far. But one day we will be, perhaps, hopefully, in a more augmented world where we can work, not having to be so fixated on a screen, not having to be so flexion dominant, perhaps a little bit more dexterous and free to move and the like.
Yeah.
Would love to see it change.
Right. Well, I mean, I see what you're saying with the balance though. Like, I think for me, my body sort of tells me whether I should stand or sit. It's almost like I get a little bit uncomfortable, so I feel like standing up, and then when I'm feeling a little bit uncomfortable there, then I sit back down again. So I suppose it's quite important to just sort of listen to your body until the time that we have other technology that might help us a bit better, rather than hunched over a laptop.
That's it, and it's also catching yourself at the top of the cliff, recognizing when a position is being a stress to your system. Pain is the last symptom that something is going wrong.
Yeah.
So for myself, and where I train other people, is if you feel yourself lapsing a moment of concentration, it's not a lack of coffee. It's the body telling you, whispering to you instead of screaming at you. Perhaps change that position, perhaps have an extension break. And the like. We all have to find what our cues are. It may be your eyes are going out of focus. It may be you might be, lifting your eyebrows to look at the screen. Tired. There's many signs long before pain and poor posture is the problem.
And when you get some of those signs, don't ignore it. That's your body trying to tell you something. So do something then, rather than waiting until it's much worse and when you have to go see a doctor or a chiropractor or a naturopath. So those were really good tips. So the 3 key things. So there was the flexion, extension
breaks, remembering wrists and fingers. 30 seconds, 5 times a day.
Yes. And there was also the sort of bringing complexity to your day.
Making it more complicated so the body responds better.
That's perfect. And I suppose it's just listening to your body, isn't it? It's just
listening to your body, and some might call it 1-minute meditators or micro breaks. It's where you are taking a moment to concentrate, ignore the rest of the world, and concentrate for 1 minute on where you are. You know, are these muscles soft? Are these muscles soft? You know, do I need to change my mental state? Can I shake some of the stress off and then start again? Reset.
Note these things down, guys. Okay, so I'm sure there's a lot of people who've just been listening in would love to come and see you. Now, for those people who haven't visited a chiropractor before, what does it look like to go through a chiropractic procedure? What are some of the expectations? What are some of the things that you know they might want to know before they come in?
Yeah, so chiropractic is in its training a minimum 5-year course. We do a diploma in health sciences and then move on to a 4-year bachelor degree in anatomy, physiology, diagnosis, pathology, radiology. We are trained to take, read and diagnose from X-ray. We employ all those things we've learnt into our initial consultations. For me, it's roughly between half an hour and 45 minutes, where we first interview the person, discussing their health history, what's led them into the office. From that, we can then direct our physical exam by doing the right tests to identify the issue in the area that's the problem.
Yes.
Get neurological exams done to work out where is that tingling coming from. We're then able to get markers of where are you now with your range of motion versus in 8-10 visits time, where are you now? When we are measuring functional improvement, we know we will end up seeing symptoms improve as well.
Yeah.
After that history and physical exam, we may or may not need to do x-rays to check for underlying conditions which may be completely separate from why they came and saw us.
Right.
Back pain can be representative of many things, and we need to make sure that we are doing the right service and this is the right place for that person's concern. After x-rays, we also have an insight machine that measures heat, muscle activity, as well as your autonomic nervous system and how balanced it is between fight or flight and that parasympathetic system. Sometimes we will adjust if the person is just terrible, and we know we can provide an adjustment in the right place and the right time to start the process off. We will. But in a lot of cases, if the person isn't too bad, we will take our time, even if it's half an hour, send the person away or make an appointment that afternoon or the next day, just so us as a practitioner can cross-correlate how do those x-rays relate to the scan, what that person told me in our physical findings. You know, think more critically about what is the what can we present to the person as a likely expectation. What can they expect? Yeah. And sometimes, you know, people are like, oh, that's quicker than I expect, or they go, oh, I didn't know the body would take that long to heal. So every case is very different.
Absolutely.
But certainly, yeah, in the instance, the initial consultation is 45 minutes, and then every other visit after that, the treatment visits, are about 10 to 15 minutes at a time.
Cool.
And it's a matter of just taking what we've learned and repeat until we see less adjustments, less symptoms, greater functionality, and then we reduce that frequency that we're seeing them down and down and down until they're hopefully under some form of maintenance. Yeah,
that's and this is one of the reasons why I love sort of referring my patients on to Joel, because you're very, very comprehensive, and the information that you get, you know, you get a personalized folder with all your information from possibly the x-rays that you might have, the what do you call it, thermograph?
Yep, the spinal scans.
Spinal scans. So, you know, I've had my patients come back with all these reports that they have a full understanding of what that means. You know, they point to me saying, look, this is what's happening and this is why I'm getting these symptoms. And that's helpful for me because I go, oh, well, that makes sense. We talked about what the possible causes are. Now we know some of the things that might be causing the musculoskeletal issues or even beyond that. So it's been fantastic. And the second thing that is the feedback that I've got from my patients is you're very good at communicating those things, and hence why they understand everything that they see. So this it's always a pleasure just, you know, sending my patients and them coming back all excited and you know, just looking at their reports and knowing what's going on with their health. Yeah. So yeah, you know, I can't thank you enough for looking after my patients. Now, I believe that, you know, there's probably like some questions that people would like to ask you, and I know at the top of that list is usually around the cracking or the popping sound, and people might feel a little bit apprehensive, especially if you know, this is their first time seeing a chiropractor, or they might have heard something about that that I believe would be a misconception. But yeah, can you explain a little bit around like the safety of it and what it means, the popping and the cracking?
No, for sure. And I think a lot of people have watched, in a way, too many Steven Seagal movies.
Yeah.
He makes it look way too easy. Our body innately is built with 16, in some places 32 times more sensory receptors in our neck muscles than anywhere else in the body. So we can feel a little bit vulnerable around our neck. A chiropractor, when they're adjusting, whether it be using their hands or with a impulse device, all they're doing is taking that vertebra that is slightly off and fixated, moving into a position where it should be and giving it a shake. It's that sensory information from the impulse of the chiropractor's adjustment that makes the brain change what those muscles are doing. It is not a grandeur of motion.
Yeah.
And we refrain from using the word manipulation. Manipulation refers to an unspecific force in multiple areas of a body,
Right.
whereas we call it the chiropractic adjustment. We're taking one vertebra, which has the potential to have 6 different joint surfaces, 2 facets at the top, 2 at the bottom, 2 discs. This is when we put that impulse in there, we can hear multiple sounds as the vacuum is released within those joints. Like if I cup my hands, hold them together and pull apart, we hear a sound. That is the sound of the adjustment. It's the sound of fluid under pressure turning for a moment into a gas and then back into a liquid eventually. Yeah. And we say eventually, this is why you can't repeatedly crick a joint. The gas has got to reform, just like the bubbles in a soda.
Yeah.
Have to reform in order for that can to make a pop.
Right.
But yes, no, chiropractic is incredibly safe and effective. And part of our initial consultation is talking about all those concerns that somebody may have around some rumours that they've heard, which we like to dispel and be able to provide the facts.
Yeah, that's fantastic. And what are some of the other sort of FAQs or common questions that you get asked around chiropractic?
Yep. Some people have heard from other people, if you start going to chiropractor, you've got to keep going to a chiropractor.
Yeah, okay.
And I personally like to meet people where they're at. If they say, my goal is to get more comfortable, that's fine. We can work to here and get you more comfortable. If they say, come to the understanding that I know my connective tissues have changed so much. Once I get out of pain, I want to work correctively on changing the underlying structure of my system. And after that, if they want to continue on and maintain what they have, but also have a greater resilient system that is able to cope with the daily motion of stress that will not stop through our entire life, then they see chiropractic more as a lifestyle tool, part of their tool belt alongside exercise and nutrition. So in answering it, it's like saying, would you go to the gym to get health and then stop?
Yeah.
Some do.
Yeah.
Some do.
That's a good way of putting it.
They also might come back and revisit the gym later on.
Yeah, some people do. Yeah.
And I have people track me down after a 2, 3, 4, sometimes 5-year break. So, do you have to keep going to a chiropractor? No. Do people decide that it becomes part of their lifestyle choice? Yes.
Yeah. And I suppose I'm sort of the same with my patients as well. It's, we go into what's called a maintenance phase where, they might not necessarily need to come and see me every month, but it might be every 3 months or 6 months just to get a checkup and make sure that everything's on track so that we're not going down the same pathway that they went down in the first place. So yeah, that maintenance is very important, isn't it? Yeah.
Yeah, and it's good to check in on people. Ourselves, we're all guilty of moving day to day and not noticing that pressure and stress make changes. Don't know about you, but it's when I see a patient after 6 months and go, oh, heck.
Yeah, every now and then.
Yeah, and they didn't even see it coming. So yeah, it's good to keep tabs on people.
Definitely. Okay, and I suppose, surely you must see a lot of different people coming through here, but do you specifically focus on a certain groups of people that have certain conditions or a certain field in health? Is there a specific focus for you?
Yeah, I guess like the theme of today being stress and posture, the whole neurology of posture and how it affects us mentally and emotionally is an area that I have seen a lot of people in. Having worked in a major metropolitan area full of offices, I got the opportunity to see a lot of people chained to their desk in the same position and how it was affecting them mentally and emotionally. That person is going to take that stress throughout their community, and it will interrupt how they are as a person and who they want to be. So my passion is really around removing areas of pressure and stress from a spine so that nervous system can be happy and healthy and that person can live a more purposeful life. And being chained to a desk is one aspect of how that person got there. So yeah, helping particularly desk workers deal with symptomatic issues such as numbness and tingling, headaches, and the like, so that they can be better, happier people. That's sort of the where I've had a lot of positive results and take great pride in the results.
And it's definitely a very important topic to address because let's face it, everybody's, they spend a certain amount of time during the day where they're looking at their phone, they're looking at their laptops, and they're hunched over a desk. And there's so many micro stresses these days, so I think it'd be really important to even just incorporate some of the easy exercise that you've taught us today, and if it's something that needs to be addressed properly, then they can come and see you and have those things fixed up, I suppose. Yeah.
Checked in and looked at. No,
nice.
We don't know what we don't know until we find out we didn't know.
There it is.
So.
Well, that's perfect. So, okay, so for those people that do want to come and see you, who are in Auckland, New Zealand, and are interested in coming to see you, how can we get in touch with you?
One of the most easiest convenient ways for people would be online, going to bayschiro.co.nz.
Yes.
And filling in their details, choosing myself as the practitioner, and then you will be sent the digital online forms to fill out before you get to the office.
Awesome.
If you're a little bit more old school, you can call as well, 478-6578.
There we go.
Either we'll pick up the phone or leave a message and we'll get back to you as soon as we can.
Yeah.
But yes, online is definitely the easiest and quickest way to get that appointment secured.
Perfect. And I'll note those details at the end of the video, so just make sure you get those details at the end. And yeah, I suppose this comes to the end of the webinar series, episode 4. Thank you so much for joining us today and giving us some of those tools that we can use at home to just reduce that stress in your posture. It's been very educational. It's been an absolute pleasure sort of working alongside you and treating our patients, and they all seem to be pretty happy. So yeah, I'm glad we were able to develop this working relationship.
Yes, no, likewise, and look forward to more of it in the future.
Yeah, definitely. We should be doing more webinar series, and we definitely would like to invite you back for other topics. So yeah.
Any suggestions of topics as well are welcome.
Yeah, comment below.
Yeah.
Oh, I've always wanted to say that. Now I'm just going to adjust my posture a little bit before we say goodbye, but thank you all for watching today. Please subscribe to the channel, and if you want to see the other videos that are available, please do. They are all there for you to have a look and get more information about how to look after your health. So thanks again, and hope to see you next time.